The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the Weymouth Community Access staff or its board of directors. WCA, in compliance with FCC regulations, is prohibited from exercising control over the content of independent member-produced public access programming.
And I was admiring the pictures, Dr.
Yes,
Wolfert.
right.
Thank you. It's Dr. Rick Wolfert.
Richard, yes.
Richard.
Rick,
W-O-L-F-E-R-T.
that's correct.
Excellent.
Yeah.
And I happen to know your dental hygienist loves you.
Oh, Elizabeth's a wonderful person.
Yeah, she
yes.
raves about you, and when you have an employee talk so well about an employer, she
That's nice.
accolades.
Very nice. She's
And-
been with me 12 years now. So
12 years, and when you keep somebody that long.
yeah, and my office manager's Debbie's been with me 24, and I have other employees that have been 10. So I appreciate that stability, and I think a lot of patients do as well.
Oh, I think so, because when you go to the dentist, I think you know who you're going to get, you know them, and there's
Yeah.
that. I think that's such a even more important than a doctor. Dentist looks in your mouth. I mean,
Yeah, we get pretty close to you.
we do get
exactly,
pretty.
and you have to trust, and familiarity builds that trust. So I like that my staff's been pretty stable over the years, and I do appreciate them. So
Now, do you have another dentist in your office, or it's
no,
just you?
I'm by myself, and that's one of the
That's
reasons.
so unusual today.
Yeah, it is. But again, it's familiarity, and I think that when people come to see me, they know that if they have a question or if they have a problem, they address it with me. There's not a lot of layers between me and management, so to speak. So I think that that's a good thing. Yes, unfortunately, the cost of running a business is high, and other dentists bring other dentists in to lower those costs, but I was in that circumstance before, and I prefer to be alone and practicing on my own.
And where are you?
I'm in South Weymouth, near the air base, diagonally across from the 99 on Route 18, Main
Oh,
Street.
I was at
that's a great-
Stockholders
great
last
place.
night. You're down near there then.
Stockholders is great. In fact, I'm running a program where if I get a referral from one of my existing patients, I give them a $50 gift certificate to Stockholders.
Well, last night was a Tuesday, and I tell you,
It's
Dr.
packed.
Wolfert, it was a waiting line. Must have been, I
Yeah.
said to my son-in-law, 10 people here are waiting in line on a
Yeah,
Tuesday evening.
I agree. I mean, I remember back when it was the Village Steakhouse, and it was always busy then. So it's,
Oh, it must be a good location.
It's a good location
so
for a steakhouse.
Yes. And you do everything. I mean, if I said to you, Dr. Wolfert, I want an implant, I want whitening, I want to have my teeth cleaned, I want a cavity filled, I want you to straighten them. Do you do all that?
I'm what's known as a general dentist. So I do a smattering of everything, but if it's beyond my capabilities, I refer to a specialist.
Do you do your own root canal work, or do you refer?
I refer most of those. I do minor root canals. The teeth are different complexity. The back teeth are more complicated because they have more roots, and the roots are curved. So it's not something that I feel comfortable handling. So I do a lot of my referrals to Hingham Endo, who was started by Dr. Douglas Stewart, and he does a great job, as well as his partners. So
Okay, so you're very confident in sending somebody there.
I have a good referral base. I try to get referrals that reflect my philosophy, and it's taken me a while to get there, but now I feel very comfortable with all the referrals that I utilize. So,
How long have you been a dentist?
32 years.
32, and you're with the
32
National
years.
Guard.
With the National Guard, about the same amount of time.
What are you? Are you
I'm a colonel.
a colonel?
Yeah, and
What's that mean? I'm impressed. How quick to go to a general?
well,
How
one
many
more rank to go to a general, but that's not something dentists generally become generals, because we don't command troops. Generals usually command troops. But
Are you a dentist there?
I'm a dentist. We have a dental department within Medical Command. Medical Command has dentists and physicians and nurses and physician's assistants and medics. And we do the screenings for the soldiers that are being deployed to Iraq, and then we just do general screenings on the 7,000 soldiers that now serve in the Army National Guard Reserve.
7,000 soldiers.
7,000 soldiers. Yeah.
I'm very impressed. I thank you for your service. I think that's wonderful.
Thank
Could
you.
you ever be deployed, or you?
I was deployed in 2004 for a 3-month period in Iraq.
Were you?
So
We'll have to do a
during my
show on
service.
that.
Sure, we can do that.
And tell us about your dental practice. You have a lot of things.
Well,
Tell us first, teeth. You're born with them? Infants are born, they have no teeth, right?
They're developing in the jaw when you're born, and then they erupt as primary teeth, and then
When? What, a year?
yeah,
Start to come out?
Yes, they start to erupt about a year, and then by the time you're 6, they start to get loose, and you start losing your primary teeth, and you start getting permanent teeth. So you have a second set of teeth that come in.
What should people do to keep their teeth? I have terrible teeth, so what, well, my parents didn't know, years ago there wasn't all this information out. Fluoride, everybody should have that?
I believe in fluoride. The fluoride's a huge component in preventive care. If it's given to a kid young enough, that fluoride actually gets incorporated in the tooth and makes it very strong and resistant to cavities.
And how about being resistant to cavities? What should we avoid? What should a parent?
Sugar is the biggest culprit to getting a cavity.
It goes into the?
It creates it combines with the bacteria, and the bacteria from the sugar creates an acid, and that's what causes cavities. It also causes gum disease. So the thing that you want to do is break that chain. So if you can remove the bacteria, which is plaque, which is removed with brushing and flossing, then you break the chain, you don't get cavities, and you don't get gum disease. That's the key.
Do you treat gum disease also, Dr. Wolfert?
I treat the more minor gum diseases. I don't treat the well-advanced gum disease. I leave that to my specialists that I refer to. One of my major referral sources is Dr. Moan out of Braintree, who's an excellent periodontist, and I also use Dr. Shapiro in Brockton.
Isn't that wonderful that you have all these resources?
They're wonderful dentists, and they focus on that particular arena, so they learn a lot about treating that particular problem. Periodontists and oral surgeons also make implants, and that's what I have set up here. If you
And we're going to talk about that. You have somebody who cleans your teeth. How often should you clean your teeth?
Elizabeth and I have 3 hygienists, but
Do you really?
Elizabeth's my full-time hygienist. She works for me. She's the one that's worked for me for about 12 years, and she works about 22 hours a week. Then I have Marissa, who works about 10 hours a week, and then Lissa, who works about 5 hours a week. So I have a good smattering. I try to cover a lot of hours because I'm in competition with other practices that have a lot of dentists that have, and they offer a lot of hours. So we try to cover early mornings, early evenings, and Saturday.
Are you there all the time, Dr. Wolfert?
I have to be there. As a dentist, you're supposed to be there to supervise if a hygienist is working. So that's by law.
I didn't even know that.
Yeah.
See, you learned it on the Phyllis
Yeah,
show.
that's by law. I'm not there 100% of the time. There are occasions where I'm not, but I'm there 99.5% of the time.
I would think so,
Yeah.
being a dentist. And you're going to talk about what?
Well, I thought today we talk a little bit about implants. I brought some models along to kind of show
Implants.
the public what we can do with implants. Implants are a very common thing now. We've had implants. They started to be developed in 1955 by this surgeon in Toronto, Canada. His name was Brainemark, Dr. Brainemark. And so he started developing them because he noticed that if he drilled a hole in a bone and he put a piece of titanium in the bone that had fins on it, the bone would actually grow around it. So that's what happens with an implant.
What would happen if you didn't have that? You'd pull the tooth?
Here's a good model to show what happens, okay? Here's a person that's missing a tooth because here's a model, okay, not a person, a model, where we have a missing tooth. Now, this patient could have lost the tooth because of gum disease, could have lost the tooth because it cracked in half, could have lost the tooth because it had bad decay. There's many reasons why people lose teeth. But what we want to do is replace that missing tooth. So there's a couple of different ways that we can do it. Conventionally, and in the past, we didn't have the implant to utilize. So what we had to do conventionally was we had to trim the teeth on either side of where the tooth was missing to make room for a crown that would go over the top. And then what would happen is we would take these two crowns and actually solder another crown in between where it would fill that space in.
You don't take it out, it's permanent in your
Yeah, this
mouth.
is actually cemented in. This is called a bridge, and it's cemented in. Now, this is all we had in the past was bridge work. We couldn't do anything else. Well, with the advent of implants, we don't have to manage the teeth on either side of the space. What we do is we take an implant and we put it in. We drill a hole, put the implant in, and the bone in the jaw grows around those fins.
So when you do an implant, you would work on the tooth first and then it has to heal for a while?
The tooth is removed.
Yep.
We have to wait 8 weeks for the bone to heal.
8 weeks?
8 weeks, 2 months. Okay, then we place the implant. They drill a hole where the tooth was, place the implant, the bone grows around that implant, and that takes 3 months. So that's another 3 months, 2 to 3 months. It depends on the type of implant that's utilized. During that time frame when the implant is in here, a little cap is placed on, a little healing cap is placed on the tooth. So what you see is this. You don't see much, but that's what's going on. We're waiting for the bone to integrate with the implant. It grows around the implant.
Wait, do you have to have enough bone? Does everybody have
Very,
enough bone?
very important to have enough bone.
How do you tell that before you
the
work?
implantologist has enough experience to know if you've got enough bone. And if there isn't enough bone, he puts bone in there.
Grafts it?
They graft it with bone, that's right. And if there's a grafted site, you have to wait longer than the original 3 months. Sometimes it's 6 months, sometimes it's 9 months. So you have to wait longer to make sure that that grafted material gets incorporated into your natural
What would
bone.
make you not have enough bone? Are there certain people that don't have it? Excuse me.
Well, periodontal disease can cause a decrease in the bone. Infection around the tooth can cause a decrease in the bone. So there's a couple of different reasons that can cause a lack of bone that's enough to qualify to put an implant in.
Is that a permanent thing, Dr. Wolfert? For the rest of your life, will that
Implants
stay?
will be in there forever. If it integrates, which 95% of the time it will.
That means if it holds.
If the bone grows
Goes
around
around
it, then it's there forever. Okay.
How would you clean? First of all, how would you? People said to me when I saw somebody the other day, ask your dentist, how do you clean your teeth? How do you clean an implant? How do you?
Let's move along. After the
Okay.
implant is integrated, we take this healing cap off, and I'm opening it. There we go. And the second stage of the implant is placed. Now the second stage comes out into the mouth, okay? And so that's above the gum. And then once that's placed, we make a cap to go over the top. So
there's another dentist involved to make the cap.
that's my job.
Your job. You didn't do the implant. You sent me to someone, but now you're making the cap.
Some generalists place implants, but I don't.
Okay.
Yet. I hope to someday.
Okay.
So I'm responsible for making this part here that comes out into the mouth and the cap that goes on top. That's
Will the
my
cap
job.
last forever too?
As long as you keep it clean. The nice thing about implants is that they're made of titanium. So they're not going to decay.
They're not.
They're not going to decay. So they're there for a lifetime.
Dental floss in between and all that?
You keep them clean like you would a conventional tooth. You brush and floss.
Do you like I know you like flossing, but how about the electric toothbrushes? Do you prefer that over a regular?
No, it depends on the patient. You know, if I see that the patient's having a hard time with a conventional toothbrush, they're not doing a good job, then I'll recommend, I like the Sonicare toothbrush, which is an automatic toothbrush that the research shows does the best job.
Good to know.
So the key about automatic, whatever type of automatic toothbrush you use, the key is that you don't use it like a regular toothbrush. I have a lot of patients that come in after we've given them a automatic toothbrush and say, I don't think this works as well. I say, well, how do you use it? Well, I use it like I do a regular one and I brush with it. The key to using an automatic toothbrush is to place it and let the toothbrush do the work. Don't do this. Place it, let the toothbrush do the work, then move to the next spot. That's the key.
All right.
Okay. So, Phyllis, you asked me about other issues about implants. You asked me about people that have lost all their teeth, okay?
Do they all do implants? They're expensive, aren't they?
Unfortunately, there are people that have lost all their teeth, and there are many ways to utilize an implant. Okay, one of the ways is once the implant is placed, there's these devices that you can put on top of the implant that don't accept cap work, but accept a little female insert in the denture that actually snaps into place.
So
You can have a denture, false teeth that actually snap in.
And never come out?
No, they come out and so you can clean things. Okay, these come off. Another way to manage implants is we can make a bar that fits on the implant, and this is even more stable.
Oh, I love the way he's catching it.
And this has little inserts on the denture, and this goes over that, and that also snaps in.
Do you have to take that out too to clean
You take that out, okay? Now, the third way is, I think, what you're talking about. Oops, I better get those screws back. This is another way to manage implants. The implants have been placed. This device actually screws into place. So this is a denture that you put on here, and you go to the dentist and he screws them in.
They don't come out?
They do not come out unless I take them out. Every 6 months, every year, I'll get you in, we'll take them out, we'll clean things
Yeah,
up.
what
we'll
about
put it
bad
back.
breath and all that?
Oh, you got to keep these clean, just like you would regular teeth. There's no doubt about it. But that's another way to utilize implants in a practice. And I love implants. I think they're a great attribute and
Are they
addition.
expensive, Dr. Wolfert?
They can be. Okay. Here's what our actual implant looks like. It's not big like the ones I showed you here.
Can you catch? And he did. He's terrific, Russ.
Okay, so this part here is actually this part here, okay? And then this part here is actually that. So what happens is this part goes into the jawbone, and this part is the second stage that fits into the implant like that.
Do you feel it, Dr. Wolfert? I mean, is it painful to do the whole procedure at all? Besides being time consuming?
Surgeons generally like to, some surgeons like to sedate you.
Okay.
So
you
you're
mean I would
asleep.
think they would? Oh, sedate you.
Sedate you so you're asleep. There's some surgeons that don't, and what those surgeons sometimes do is...
Novocaine?
Oh, you definitely use Novocaine.
Okay.
But in order to make the patient feel less anxious, they'll give them a little pill to take before they come in, which makes you less anxious.
I
So
need 12 pills.
Yeah, or 12 pills. Maybe you're the one that needs to be sedated.
Probably.
Yeah,
so
so-
sleeping. You mean sleeping?
Sleeping, yeah.
Can you
sedation
be
is like
sleeping? And how does your mouth stay open?
Well, they'll prop you open, and they have dental assistants that keep you open, keep the saliva away, and it's a team effort, and it's easily done. In regards to the post-op discomfort, there's a little bit, but it's not dramatic. I've heard from other people that have had it done. I had one myself. It didn't bother me at all. But some people say, well, it feels the same as when I have a tooth removed. I have a little discomfort for a couple of days, and I'm fine. So it's not a big deal.
What toothpaste do you recommend? I know you may not want to go out and live, but is there a certain, I mean, toothpaste with fluoride? Is there a brand name Colgate or another? There's so many out there.
There are
I
a
go to
lot.
Walmart and I say, "Ma, I don't know what to do."
There are a lot of toothpaste. I think the major brands, Crest and Colgate, are good ones because they have fluoride in it. The important thing is that the toothpaste has fluoride in it. You know, when you get older, the fluoride plays another role. When we're giving a child fluoride tablets, that's so that the fluoride gets incorporated into the tooth itself from the inside. You know, it goes into your bloodstream, it goes right to the tooth and gets incorporated right into the tooth, the fluoride ion. Now, as you get older, that's not possible because it's not the tooth is not developing anymore. So the advantage to fluoride as you get older is that it sinks in the tooth from the outside. And it works more slowly, but it still works. It's particularly important in the elderly because as you get older, if your home care hasn't been ideal or if you grind your teeth and your gum tissue recedes away from the tooth, it exposes a part of the tooth that is more susceptible to cavities.